really important as we kind of go through this presentation is that we think about the mindset in which we are operating from, which is a little bit more postmodern than what might maybe families or clients think about old fashioned therapy, which is that it's linear and we're working with one person's problem set. You'll see kind of intertwined throughout the entire presentation that the intention is that we identify the entire family system as the IP or the identified patient, if you will.
One of the things I want to add is I want you to really take a look at the word language, because it's also, we have to model this new language for our patients and clients. And what I'm going to say to you is that I stopped talking to clients and families about problems and issues, and I started talking to them about challenges and opportunities, because we have to change the landscape. Remember, I told you I wanted you to look at language and landscape as we go through this with family systems.
So how do we educate and process with family members what specific things look like? I know at Futures, we spend a lot of time with families, whether it be during individual sessions or family sessions. And now Dan has created an entire family weekend or workshop for families to come in and really dive in and talk about what their expectations are, what the problems they're facing are. And it really becomes more
The
individualized.
hardest part about talking to the family about enabling or any other behavior is to support the recovery. The recovery is about a process of living. It's not just a process of getting well. It's a process of living and living a better life. So in that process of living, what are going to be the new resources and the new relationships?